has started off already, eager to hear what others have got to say. Welcome to the 2025 public hearing on the Ballad Health Certificate of Public Advantage, which is more commonly called a COPA. We appreciate you taking the time here this afternoon. This hearing will be devoted to public comments related to the COPA issued by the state of Tennessee in January 2018. The scope and purpose of this hearing is to discuss the public benefits or disadvantages of that COPA. So this is not the forum to address particular licensure or hospital or physician provider issues or complaints. If the speaker has those issues, we encourage you to submit them to the Tennessee Department of Health website, and those issues will be forwarded to the appropriate division. We do that all the time. So we appreciate your participation as always and value your comments. My name is Jim Mathis, and I'm the COPA Director for the Tennessee Department of Health, and this is Commissioner Dunn, who would like to say a few words to begin us.
Yeah, great. Thanks, Jim. Can folks hear me okay? Just looking for some cues. Talk a little louder? Okay. Thank you guys for being here tonight. Again, John Dunn, I'm the Commissioner of Health. Was appointed by Governor Bill Lee in July. Our previous commissioner was Dr. Ralph Alvarado, who did the public hearing previously. I've been with the Department of Health for over 20 years, so I remember when the COPA was initiated. Most recently, I've served as the state epidemiologist from 2019 to 2025. When the merger occurred 7 years ago, as Jim mentioned, we did the state's Certificate of Public Advantage or COPA approval, and our team, which I would also like to acknowledge and thank our team that's here tonight, has been continuously monitoring and providing oversight to the COPA. So we're glad to be with you tonight. As in the previous public hearings, we want to hear directly from you about your healthcare experiences related to COPA. Our team has developed the terms of certification, or what we refer to as TOC, to guide the oversight of the COPA. Our department coordinates also with the Tennessee Office of the Attorney General in providing oversight. And the TOC has evolved over the years as healthcare has evolved over the years. Our department's role is to provide active oversight of the COPA to ensure that the merger continues to provide a public advantage to our citizens who we serve in Northeast Tennessee. And as Jim mentioned, we don't manage the business decisions day-to-day or medical operations for Ballad. Our goals with the COPA are consistent with our overall mission, and if you haven't heard, our mission at TDH is to protect, promote, and improve the health and well-being of all people in Tennessee, and we want to see continued improvement in the health and well-being of our citizens in this region and maintain access to high-quality health care. Throughout the COPA, we've taken a data-driven approach to the provision of the oversight, and that includes continuously receiving feedback, like tonight. We're glad to hear from you tonight. We also receive direct feedback and reports from Ballad as part of the process, and we're committed to transparency in our role in doing the monitoring and keeping the public up to date on the process. So we look forward to hearing from you tonight, and thanks for taking the time to be here.
Good. Thank you, Commissioner. In addition to Commissioner, I would like to introduce Judy Connect. She's the Assistant COPA Director and more fully the Assistant Director of Population Health and Navigation for the department. She's going to be keeping track of the time and taking notes of comments. If nothing else, let's go into the public comments. The first speaker is Liz Phillips, to be followed by Emma Lammons.
Good evening. My name is Liz Phillips. It's Phillips. I have been a cancer patient with Ballad Health since 2020. and I have been through a whole lot. Not a very positive outlook, and with mindset and fantastic medical teams that put together a program to help me through cancer, I'm here today to speak to you. It matters very much about public access and availability, particularly in a rural area, such as where I live. And you may not think of Johnson City or Kingsport as rural. You might not think of Bristol as rural, but when you compare it to Atlanta and places like that, it's a small place, and we're very community-minded. So it was important to put together a medical team that could take care of my needs. I didn't want to be a victim. I wanted to be an advocate, and they worked with me. I went to all kinds of doctors. I went through all kinds of surgical procedures to save my life, and every single time it was Ballad. Ballad doctors, Ballad nurses, the OR, the ER, it didn't matter who took care of me. I got the best care. I never once looked to see if I should go anywhere else. There was never doubt in my mind that this is where I needed to be. It was my home hospital, and I still feel like that. And when I get ready to go through the next steps of cancer, because as we all know, it's going to come back someday, I'm going to continue going to the Bristol Hospital, the Ballad Hospital, whatever it's called, because it doesn't matter what the name is. It matters to me that the people who work there and the people who care for me give me the best care possible. And I have never, ever had any experience in any of that hospital or any of the satellite offices with doctors where I haven't had the best care possible. And that's what I want to say. I know people want to tell you what's not working, but I really think it's the people, and the name doesn't matter so much. And I just wanted to share that with you this evening. Thank you.
Thank you, Ms. Phillips. So Emma Lamons, followed by Jeff Taylor.
Hi, my name is Emma Lamons, Lamons. I'm a person in long-term recovery, but once upon a time, there was a time where sobriety wasn't even in my mind. And then I lost custody of my youngest daughter, and I was provided with the opportunity to go to Strong Futures through Ballad Health. And they completely turned my life around. They provided me with the tools that I didn't even know that I needed or was missing in my life. And they provided me with resources that I didn't even know that our community had. My treatment team at Strong Futures went above and beyond for me, and they do for every other client there. Because once I graduated the program, they saw something in me that I didn't yet see in myself. And they actually gave me an opportunity to work there. So now I get to give back to the program who gave me so much. And it's an honor because they do such good work in the community. They also provided me with opportunities to work with Strong Starts and Strong Families. And I wasn't even aware that those were programs that existed in our community until I became a client of Strong Futures. They just do so much good, and I feel like sometimes it might be overlooked because recovery care is a very big need in this area, whether people want to look at it that way or not. Thank you.
Thank you, Ms. Lamons. Jeff Taylor, followed by Anarine Blackwell, I believe.
Hello, my name is Jeff Taylor, Taylor. I'm actually from over in Lee County, Virginia. I want to speak today of the importance of the rural hospital. On December 16, 2024, my 7-year-old grandson, Lincoln King, was injured in a pellet gun accident. We took him to Lee County Community Hospital, which operates under Ballad Ballad Health, and we were met with a team of medical providers, doctors, nurses, even receptionists that saw the seriousness of my grandson's injury, and the weather. They stabilized him and realized that he needed a more extensive type of care. They wanted to take him to either Knoxville or Niswonger in Johnson City, but the weather would not permit. They could not med flight him. So they coordinated with a rescue squad out of Wise County, what was apparently the best that they could find. And one of the doctors rode with my grandson to Johnson City and Niswongers. And I didn't realize until April the reason that the doctor had rode with him. It was because there was a fear that he would go into cardiac arrest and pass away. So I want to thank Ballad Health, the medical professionals, the doctors who we have met afterwards. We feel like they're family. We appreciate them greatly. If Lee County Community Hospital had not been opened in 2021, reopened that is, my grandson would have probably passed away, because I can see us in a panic trying to get him to Kingsport or Big Stone Gap Hospital, and he would have probably passed away. But my grandson is doing well. When he had two open heart surgeries in 4 days. When they removed the pellet from his heart, it hit him in the heart, entered into the pericardial sac. He was filling up with fluid, was going to bleed to death. But once they got that pellet out and they started checking him out, which they do, I guess, they found that he had a heart defect from birth, and they had to send him to Vanderbilt University to have another heart surgery. But I'm here today to say thank you to Ballad Health, and I think it's very important through COPA or whoever did it. I know we live in Virginia, not Tennessee, but whoever, Ballad taking on Lee County Community Hospital, saved my grandson's life, and I will forever be thankful. And thank you today.
Thank you.
Hello, my name's Andrea Blackwell, Andrea. I don't know where to start. If it wasn't for Ballad, I wouldn't be standing here with this 6-month-old son that I have full custody of. I don't know where to start. I was referred to Strong Futures through my treatment team at Over Mountain. And through Over Mountain, I have a great support system with Strong Futures as well. And then with the Strong Futures, they got me referred to other places like Strong Starts, and along with my mental health therapist and all that. I thank God for it, because if it wasn't for that, because this time last year I just found out I was pregnant, didn't know where to start, had no idea, had no faith in myself. The only person that had faith in me was my other half, and I didn't think I could stay, that I would have him sitting here with me today. I thought they'd take him away from me as soon as I had him. But I was introduced to Strong Futures through Over Mountain Recovery, and I'm able to stand here with this happy boy today. And I thank God for my treatment team and everyone that I've met along the way. Thank you. That's all I got.
Thank you.
Thank you, Ms. Blackwell.
Hello, my name is Tiara Arp, Tierarp, and I was a participant in the Strong Families Program at TANF Grant Program in the Population Health Department that supports regional families to strive and thrive. To really understand my progress, a little of my backstory is necessary. I was born at the Johnson City Medical Center to a 16-year-old mother. Her and my biological father were neither ready to be parents and both used drugs. I went to foster care for a while as a child, and then my grandfather adopted me. I grew up in a single-parent home with him until he passed away when I was 16. My mother and I always had an estranged relationship, and she did drugs as far back as I can remember. I spent weekends and some of the summer vacations with my mom, and drugs were common. I started using when I was 12 years old. First, it was to feel like I belonged somewhere and was wanted, and then it turned into normal for my life. I was functional for a long time, and then came the harder drugs. In 2018, I spiraled and thought there was no hope. I kept using, didn't work, and had low value in myself. I stayed in and out of jail, became a felon, and was a shell of a person. I was full of hurt, shame, and feelings of abandonment. In 2020, I found out I was pregnant with my son, and in that moment, my life changed. I stopped using, I got a job, and woke up daily trying to do the next best thing. Eventually, I started going back to school and working full-time, even though I was a single parent and times were hard. In October of 2024, I found Strong Families. Strong Families changed my life in so many ways. When I entered the program, I was living paycheck to paycheck, sharing a room with my son, and I lived daily with the guilt and shame from my past. For the first time in my life, I didn't feel alone. Strong Families referred me to Appalachian Opportunity Fund, where I received help with predatory debts, learned how to manage my money, and learned how to save. Strong Families connected me to Tennessee Voices, where I took parenting classes that brought awareness to parenting practices, helped me understand the trauma I had from my childhood, and helped me understand how to break generational cycles. Strong Families rewarded me with milestones for reaching my goals and provided barrier removals for anything that stood in my way. What I got most from Strong Families wasn't in the milestones, it wasn't in the barrier removals, but it was in the support I received as a person. My family partner changed my life. He got to know me with no judgment. He helped me stop feeling ashamed of who I used to be and helped me be proud of who I am. One thing he said that will stay with me for the rest of my life is just be you. Just continue to be you. I felt seen, I felt heard, and I felt like I was actually somebody. My family partner believed in my success before I did myself. My biggest goals seemed achievable. I now live a life I never thought I deserved and one I could only dream of. I bought my first home in October. My son and I no longer share a room. I have a career, not just a job. And what is even more amazing is now I work for Strong Families. I'm honored to be able to help other families in our region achieve the goals they thought were unreachable. I get to walk beside others on their journey to self-sufficiency. I get to work for a company that breathes empathy and compassion, that changes generational curses and provides empowerment and self-sufficiency to our region. Thank you.
Hi, good evening. My name is Dr. Denise Sibley. I've been a physician in Tennessee for 35 years. I have been through all permutations of practice positions. I'm most concerned about patients, patient access, and patient quality, and that's why I'm here tonight. The patient access to rural health care is a concern. Hospitals and their services are being restricted in rural areas, especially in Southwest Virginia, from where I was grown up. Hospitals are being turned into glorified urgent care facilities, or ERs, and they're eliminating whole groups of care like obstetrics care, ICU, surgical care, subspecialty care, and some departments such as orthopedics are closed, and patients are being funneled to Johnson City where the volume of patients needing care exceeds capacity. Patients were assured that services would be provided in their communities, not shipped off an hour or more away. Patients need access to services in their own community. New federal rural health care dollars, I believe it's $50 billion, that's with a B, to which Ballad has applied, is the antithesis of what has been happening in our area. Full reimbursement would require elimination of our state certificate of need, which would be interesting to see how this is implemented or played out in the next legislative session. Improving access to care is one part, but quality health care we expect as well. In 2023, the Centers for Medicaid and Medicare, CMS, rated Ballad a 1 out of 4-star rating. That's low. Interestingly, I can find no updated CMS rating since that time. I don't know where that is. There are numerous exemptions and exceptions that exist in the COPA amendments regarding physician employment, and increasingly physician practices are under Ballad control. Interestingly, this can lead to increased costs for the patient if they see a specialist, as this adds a facility charge, because they're associated with a hospital system, to the patient cost in addition to the professional cost of seeing the provider. Again, I am concerned about patients, their access to quality care, and their ability to see a physician and how long that takes. Thank you for hearing my comments.
Thank you, Dr. Sibley.
Hi there, my name is Danielle Goodrich. I'm the chair of the Washington County Republican Party. Goodrich is Goodrich. As Republicans, we're supposed to uphold the Constitution as binding and inflexible, and unfortunately, our healthcare monopoly is not. Per Article 1, Section 22 of our state constitution, which says monopolies are contrary to the genius of a free state and shall not be allowed. So our county party actually came up with a resolution calling for the immediate repeal of certificate of need laws, and so that we can eliminate healthcare monopolies, restore competition, and improve access, affordability, and quality of care. I'd like to read part of the resolution. Whereas the Washington County Executive Committee recognizes the paramount importance of accessible, affordable, and high-quality health care as necessary for all residents of Washington County and the state of Tennessee, essential to the well-being and prosperity of our communities. And whereas Article 1, Section 22 of the Tennessee Constitution explicitly states their perpetuities and monopolies are contrary to the genius of a free state and shall not be allowed, a provision that has appeared in every Tennessee Constitution since 1796. Whereas Article 11, Section 8 of the Tennessee Constitution further provides that the legislature shall not pass any law for the benefit of individuals inconsistent with the general laws of the land, underscoring that state law should not favor specific entities or create monopolies to the detriment of the broader public. And whereas the founders of the United States championed free markets and warned against monopolies that stifle competition and harm public good, and whereas Thomas Jefferson wrote, "I hope we shall crush in its birth the aristocracy of our moneyed corporations which dare already to challenge our government to a trial of strength." And James Madison likewise asserted that monopolies are justly classed among the greatest nuisances in government. I'll skip to some of the resolved. Be it resolved, the Washington County Executive Committee urges the Tennessee General Assembly to repeal Certificate of Need laws to restore healthcare competition and eliminate monopolistic control in the state. The committee calls upon the governor, the Tennessee Department of Health, and the General Assembly to prioritize patient welfare, healthcare access, and economic fairness over government-enabled monopolies. The committee supports judicial review of existing COPA agreements and encourages state leadership to dismantle monopolistic structures that harm Tennessee. Be it further resolved that this resolution serves as a declaration of Washington County's support for free market healthcare reform that empowers Tennesseans, reduces costs, improves access, and ensures fair wages for healthcare professionals consistent with the Tennessee Constitution and the enduring wisdom of leaders across political and economic traditions. I'll just end with my brother-in-law. He almost died from a hospital-acquired infection, and I get calls like that all the time of similar instances. Thank you.
Good evening, folks.
Mr.
My name
West,
is Joseph
followed
West,
by Kristen Reedy.
W-E-S-T. I'm so thrilled to be here, and I'm glad that you guys are here to listen to us. This is the first time I've ever spoken out about because of how strongly I feel is why I've made this move to do this tonight. I'm a retired registered nurse, critical care, 25 years, and 5 years of executive level nursing. And believe it or not, it can happen to any of us. I went through some unfortunate times, lost my house, my boat, my truck, my car, and all my personal belongings, and became homeless. And I came back to Tennessee because I was in Maryland, and Tennessee was always my second home because of my stepfather's family. I was out in Rogersville with my brother, and he died, and there I was, homeless, broke down truck, just nowhere to go. And I told my wife, she's a veteran, there's a big veteran center up in Johnson City, and there's public transportation. And, honey, if you go up there and stay while I'll get a job and get us back on our feet, because I'm willing to work, but there's just no way I could travel in a very rural environment to a job. So those are the two reasons why I came to Johnson City. But now that I've been here for a little while, that would be 2 years now, I fell in love with Johnson City. And part of why I love Johnson City so much is because of the Ballard healthcare system. I was very sick when I arrived here, and Ballard took me, I didn't have any insurance, I had expanded Medicaid out of Maryland, so they weren't getting paid. But they took me in, took care of my illnesses that I had, stayed a week or so. And while I was there, someone came around and said, we might have some resources that will help you. And he did a little interview with me. And, well, I met this angel sitting right over here from Appalachian's Highlands Care Network, which is a part of Ballard Health. And it's become evident to me through her that they reach out to everyone. They give everyone a chance. And she helped me to get back on my feet. I have no social network here at all. And I've been through multiple medical problems since then, and I've always gotten top-notch care. As a nurse, I believe I can see good care or not. I can critique it, and I feel that I've gotten excellent care no matter where I've gone in the Ballard system. I hear a lot of people in here speaking about recovery. I'm glad to know that that exists. I think we need more emphasis on the homeless and the substance abuse in our environment. But they're doing a really good job, and I hope they continue to keep their certificate of need or whatever legislation they need to exist and expand. I'm not a Democrat or a Republican. I'm a person. And laws that were written in 1700s, 1800s might not apply to 2025. We need to look at the environment that we're in now and how can we help the people that are here, because it's just not the same as it was back then. My time is up. I do appreciate you listening.
Thank you all for being here. Kristen Reedy, Kristenreedy. I can only speak to my family's experiences with Ballad, so I appreciate you all being here. I'm honored to share our experiences. They've been incredible. We grew up in this region and chose to return here about 19 years ago to raise our family. So I've seen firsthand the dedication, compassion, and professionalism that Ballad's healthcare teams bring to work every single day. A variety of my family members have received care at pretty much almost every facility in Northeast Tennessee: Indian Path, Bristol Regional, Holston Valley, Franklin Woods, Niswonger, and Johnson City Medical Center. That's covered a wide range of needs, from ER visits, births, general surgeries, joint replacements, breast cancer surgery and treatment, and even end-of-life care. In every single instance, that experience has been exceptional. From the moment we walked through the doors to the moment we were discharged, we were treated with respect, kindness, and a level of professionalism that gave us confidence and peace of mind during some of our most challenging moments. What stands out most to me is this consistency of care across all of these facilities. The doctors, nurses, and support staff have always been knowledgeable, attentive, and deeply committed to ensuring that we receive the best possible treatment. They provided medical care, of course, but they also provided reassurance, dignity, and hope, which was pivotal and made a tremendous difference to us. Another point I would like to emphasize is how important it has been for us to receive this level of care here in our region. Because of the coordinated approach that Ballad takes, we've not had to travel outside for specialized services, so that has been less stressful and, of course, less of a financial burden for families like mine. From my perspective, and this is just mine, the COPA agreement has played a role in making this possible by allowing those hospitals to work together rather than compete. They have been able to invest in new technologies, expanded specialized services, and improve overall patient care. That collaboration has strengthened our healthcare system in this region and ensured the people in our community that we can receive that care here. I think this is about keeping care local by sustaining rural hospitals and reducing the need for patients to travel long distances, investing in quality and technology, improving population health through partnerships that address addiction, which we've heard, maternal health, mental wellness, and food security, and coordinating services under COPA to eliminate the duplication and redirect resources into better care and community. My family's experiences are proof that these priorities are working and that they do matter. So this evening, I just want to say thank you to Ballad, to the professionals who serve us each day, and to those who have worked hard to make this system a reality. My family's experiences are proof that they matter and they are making a difference. Thank you so much.
Rebecca Simmerly, Simerly. When COPA was first approved, we were promised it would protect rural health care, keep quality services local, and make things better, but that promise has been broken. Instead, COPA has allowed one powerful hospital system to take over. Without competition or accountability, our communities are suffering. The quality of care has gone down, wait times are longer, specialists have left. Services that once made our local hospitals strong have been stripped away and moved wherever Ballad chooses. Now we're left with limited options, and often that means traveling hours to get the treatment we need. Let me give you some real examples. First, Ballad terminated obstetrics at our closest hospitals. That means expectant mothers in places like Roan Mountain now have to drive over an hour, sometimes in an emergency. Imagine being in preterm labor on a winding mountain road, praying you make it in time. Second, rather than expanding Niswonger Children's Hospital services to critically ill babies that can be treated close to home, Ballad focused on transportation instead. Parents don't need to be separated from their sick newborns or the stress of driving back and forth to Knoxville or Vanderbilt worrying about gas money while their baby fights for life miles away. The emotional and financial toll is crushing. Third, waiting for procedures, testing, and appointments has become unbearable. My family had to travel for cardiac testing because Ballad's earliest appointment was months out. My daughter lost her job because she couldn't get medically cleared in time to return to work. That's not quality care, that's neglect. Fourth, families who have children with intellectual and developmental disabilities are also suffering. We face a lot of struggles. My child is autistic, and our care is often pushed to Knoxville or Nashville as well because local providers can't meet those needs. For these families, traveling hours for appointments is not sustainable. Lastly, our daughter had a Bravo study at Vanderbilt and went to a local ER due to having some pain. Unfortunately, the doctor there told us he didn't know what that procedure was, and instead of calling Vanderbilt for help, he Googled it. Then he said there are no good options for gastric care here. These aren't isolated incidents, they're symptoms of a broken system. Doctors and nurses are leaving because they're overworked, undervalued, and stuck in a system that puts profits and control over patients and care. COPA was supposed to save rural health care. It was meant to protect access, and instead it has done the opposite. It's lowered it. Our most vulnerable, mothers, children, people with disability, and the elderly are paying the price. It's time for change. It's time for transparency and oversight. We need competition restored so that patients, not corporation interests, come first. Healthcare should be local, accessible, and accountable. COPA and Ballad's experiment has failed our communities, and our families deserve better. I actually have worked for some of the programs for Ballad, and I loved working those, but unfortunately, thank you. I have seen a decline in the healthcare areas, but have a blessed day. Thank you.
I'm actually impressed you pronounced my name correctly.
I'm sorry.
I said I'm impressed you pronounced my
Oh.
last name correctly. It's Lehman. I get Lehman, Lemon,
Okay.
so thank you. On October 21st, 2019, the FTC said in a press release that they would study the effects of COPAs, which included Ballad Health. There were about 6 other entities that were included on that they would study the effects for employees. What is the analysis so far, as I have not been able to find anything published? I'd like to hear this information for employees other than the nurses. The nurses get a lot of press, and they are a huge bit, but they are not the only employees that keep the facilities running. Ballad actually treats the nurses and the rest of the employees differently. Know how rumors go in hospitals. Oh, everybody's getting a raise, everybody's getting a raise. Oh no, that big raise was only the nurses. I want to hear about the other employees as well. I want to hear about the transporters, the phlebotomists. Well, cooking, the cafeteria is actually outsourced to another one. I would like to know if there has been a market analysis done for these positions and compare what Ballad is paying versus the surrounding communities. Some of these departments have extensive turnover, and it's purely because, not that they don't love their job, not that they don't want to serve the community. The issue is they are trying to serve their families as well. I would very much be interested as part of that analysis to know what the percentage of working poor there are among the support departments. What percentage of them are at or below or somewhere near the poverty line? Thank you for your time.
Thank you.
Yeah, my name is Jeff Brulport, Brulport. It's a personal story. I lived with my mom for quite some time. Things were going good. She got COPD. Her health started going downhill. I started having my health issues, all sorts of them. And then we ended up losing our house. I ended up living with my sister, which is where I'm at now. She passed away, my mother did. And then I didn't want to live anymore. I just laid around, just getting sicker, didn't care about anything. I ended up getting sick yet again, went to the hospital, and this time I finally met the people at Appalachian Carolyn High Network. And Ballad Health was covering stuff. They helped me out a lot. They put me on track. They gave me purpose. They made me find my will to want to live, and now they're helping me. I've got my insurance, all that I need, and now they finally found me some housing to move into. Life is going pretty good, and I'm looking forward to seeing what my future is. I thank Ballad Health and Appalachian Highland Care Network for all the good they do. Thank you.
Good evening. I'm Gary Mabry, M-A-B-R-E-Y. Good to have you with us tonight. This is my first time before this board, but in 2018 and 2017, and in those years when we were working on this merger and this COPA, I was here present a lot of times at that other board. Proud to continue to support Ballad Health. In that 2018-2017 period, we said this would be one of the most important things that we could do here in Johnson City, Northeast Tennessee, Southwest Virginia. I'll go ahead and toss it in Western North Carolina because I'm sure folks do come across that mountain to receive health. Ballad is committed to the vulnerable population, consistently demonstrated its commitment to ensuring that even the most vulnerable in our region receive the care they need to live healthy, productive lives. I'm currently on the Franklin Wood Community Board, and I see firsthand the incredible work that's being done there. Investments in technology, expansions, programs that truly make a difference. We've just recently added 20 inpatient beds at Franklin Woods, a direct response to the growing need and demand, and from what I'm hearing, they're already being used on a very regular basis. This will reduce wait times and ensure patients receive care when they need it most. There's a broader investment and economic impact of this and what Ballad does. These aren't just about health care. It's about economic vitality. That $160 million in capital improvements strengthened the region. It strengthened and created jobs, positions us to be globally competitive. From reopening rural hospitals to introducing advanced surgical robotics, expanding pediatric care, Ballad Health is transforming access to health care across Northeast Tennessee and Southwest Virginia. And the shared vision is for a healthier population. Thanks to these efforts, we're moving closer to that goal every day. And I have an attitude of gratitude. On behalf of the community, thanks to Ballad leadership and the board for making these investments. They're not just improving health care, they're improving lives. Certainly will make us very attractive for people to move here, live here, work here, live healthfully here, and enjoy life. And thank you all for being here, and happy Thanksgiving.
Beautiful words. We love this community. I'm Dr. Raymond Faber, former employee at Ballad, Northeast Correctional Facility, and currently in Abingdon Jail, Southwest Regional Jail Facility. I worked for Ballad from 2017 to 2020, loved it, gave my heart and soul and sweat, and saw many of these stories that if you walk into a hospital, sure, they're going to take care of you. That's the expectation. That's the standard. Has the merger been good for this community? I got a standing ovation at my last tax meeting saying why Ballad fired me as a physician, because I stuck my neck out for Medicare fraud admissions. I have a case against them, 30 plus. There were many hundreds of cases of, we live in a 1986 double wide from a family that had to sell it to pay for his wife's cancer treatment with Ballad. HMG charges 5 times less than Ballad for almost every procedure. Many of our best hospitalists left the area, went back to Washington, D.C., went to North Carolina, Dr. Lindsay Davies, Dr. Innocent Tomby, Dr. Schauberger, people that cared about this community and were the best physicians I've ever worked for in my life. When I spoke up against what Ballad was doing, and Dr. Moros Peters, who said, and I have the recorded memo of him speaking, saying that administration just told him to run an effing hospitalist program and to admit everyone and don't ask any questions. So people are going home with, and I'll give you guys a recording if you want. My phone number is 423-444-6680. I'll contact you and give you written information as well. This is the sort of thing that happened just before I was let go from my position. This is what is draining this community. Not that we don't have good doctors and people in these facilities. They need a job, but they've fired people who really cared about this community. So I will go forward, and this needs to be brought before DOJ, before the Tennessee senators that I spoke with when I was working at Northeast. And I don't think I'm going to need to do that because we're trusting that you guys really do look carefully into this. And, you know, the anecdotal stories of someone going to the hospital and getting taken care of, Dr. Sibley mentioned the real statistics. That's the bottom of the barrel of the type of care we should be expecting in this community that we love, that we've given our lives to, and we would continue to do that, except there's no other place to work in this region. You know, do I move to West Virginia? Do I move down to Florida? I'm a great hospitalist, and I can staff some of the hospitals in this area. I've broken all the admission records. But the reason, and my case is online, Ballad hires the best legal team in Nashville to fight against me, brings lying physicians who will lie under oath, and I can prove this because I have examples and all the documented evidence. That's why we appealed the case that was thrown out on summary judgment, and I appreciate you for your time, but I look forward to more information and communicating with you. Thank you all for coming here today.
My name is Catherine Milam, M-I-L-A-M as in Mary. I have several stories that I wanted to tell, but since we're limited to 3 minutes, I will begin with my cardiology group. And since they were bought out and took over by Ballad Health, there is only one of the original cardiologists in that group, and there were several, and they were all very good doctors. And he held out and he stayed. He left at the end of last year. His PA came and joined him at another cardiology practice this year. He told me it got worse. There were 3 of the cardiologists who had left at the end of 2023. So they merged 2. I think one of them would have been the HMG along with the Ballad, and they became the Ballad Health Group for cardiology. And he said they thought it would get better. It got worse for them. So he finally left Ballad himself. I know of several other specialists, as the previous doctor spoke, who have left this area completely because of Ballad Health and Alan Levine and the way it's run. I've had 3 friends with cancer, colon cancer, all of them. They had to leave this area and go to Knoxville. One other story that hits close to home is my sister-in-law, who is in her 80s 2 years ago, was taken by her children at 4 o'clock in the morning to the ER at Johnson City. She laid on a cot for 2 days. She said it was extremely cold. She stayed in her clothes so she could try to stay warm, and they brought blankets from home. The only thing she was given was some water. There were 58 people in the ER at that time. She never saw anyone. Her daughter and a granddaughter stayed with her, helped her to get to the bathroom. She said it was nasty. She said the ER was nasty, and I refused to go. I had a fall a couple of months ago. I wouldn't go to the ER. I said, forget it, and I told my son, we'll go the next morning. Finally, she got in a room around 5 p.m. on the second day. She got on the bed, took a nap. A hospitalist came in and discharged her. It turned out he told her to go to her cardiologist, which she did, and she was needing a pacemaker. And when she saw him, he told her why he could not come that night. But there's no excuse for this kind of care, especially in this area. And even though we are rural and we aren't a metropolis and as large as Chattanooga or Knoxville or Nashville, we deserve the same health care as anyone else in this United Nations or states.
Good evening. Bill Spooner, S-P-O-O-N-E-R. Last year, I spent 12 days in Franklin Woods after a ruptured appendix. I couldn't be more pleased with the care I got there. The nurses couldn't have been better. My only constructive comment would be for the staff to be better equipped to place a needle into small veins, and don't tell me those infrared scanners work, they don't. I wonder why you're looking like a pincushion. As a matter of background, I retired here after 35 years working with the San Diego health system, the last 18 years as chief information officer, and early in my career as a hospital CFO, so I've been around. We recovered from hard times in the 1990s, received Baldrige National Quality Award in 2007, and today you'll typically see 4 CMS stars in all of their ratings, so that can be done. But I'm struck by the criticism that I hear here, that I read on social media, or I hear from my neighbors about issues with care and service. They make me sad, and Ballad must chafe at some of the comments that they hear. But I will say, if there's blame to ascribe, it's not entirely to Ballad. Your role, the DOH, is to provide guidance and oversight to hospitals to ensure good care for every patient. And with the COPA, you have this added duty in this region, and you failed in this duty. Thus, you share the responsibility if there are lapses by Ballad, and I'll just explain my thoughts about that for a minute. These meetings should have been held regularly. Regardless of who requested cancellation or postponement, the DOH should have insisted that they be held. During the COVID pandemic, a Zoom meeting would have been better than no meeting. The public should have been provided with summaries. Ballad should have been given follow-up actions, with lists also made available to the public. The patients deserve to be heard and respected, but we're left in the dark. With Ballad's structure resembling a closed corporation, in that the CEO is also board chair, there is no other independent voice listening to the community. Most not-for-profit systems, as I'm sure you know, select a community leader as chair. The DOH has also not responded to other unfavorable data they hear, like the CMS one-star ratings, that when one would expect you would have some concern about. In 2023, MIT Sloan published a study showing Ballad's nursing satisfaction to be at the bottom of the United States. You should have been concerned about that, but you weren't. You modified the scoring formula to make it easier to comply, thus undermining public confidence. So I would say in general, the DOH looks like they performed as though their duty were to protect the company rather than the patients. Ballad is a strong executive team. They respond to guidance they are given. The DOH has failed to provide that guidance. The DOH needs to do its job. As to Ballad, they should revert to their original slogan, "We're listening," and then respond with humility and action. Thank you.
Hi, I'm Joy McCrae.
McCrae, sorry.
It's okay, I get it all the time. MCCRAY. I live in Elizabethton with my elderly parents who are disabled, live with me. They're 82 and 89 years old. They've been with me for about 5 years. And we are frequent flyers of Sycamore Shoals Hospital. I live about a mile from there. We also go to Johnson City Medical Center a lot too for their care. They have extensive care. We have been inpatient with both of them this year, from everything from AFib to pneumonia, UTIs, and a broken hip, all in 2025. After a long battle with AFib compounded by a broken hip, my mom finally was able to get a cardioversion to shock her heart out of AFib just last month, just in October. Her cardiology group is also with Ballad, and they're fantastic. The thought of my fragile mom, fresh off of recovering from a hip fracture in April and having her heart shocked back into rhythm, was terrifying. I'm their only caregiver. I'm an only child. Like I said, they live with me. I take care of all of their needs. The amazing staff at JCMC talked us through the process, had my mom come in for an overnight stay that lasted a couple of days because they just wanted to observe her. She's 82, right? She had a lot of complications. They checked on her constantly, and ultimately and safely, they were able to get her heart back into rhythm. She told me she didn't feel a thing. The staff was able to put my mind at ease to make me feel like I didn't have to sit there around the clock with her, which gave me the ability to go home and take care of my dad and not have to put him in a nursing facility while I checked on my mom. I can't be in two places at one time. So he was able to stay home with caregivers. My dad was so worried about my mom, and we were able to safely bring him up so he could visit her and see that she was being well taken care of and she was recovering. There's a lot of chatter about years-old issues coming from the loudest corners of our community. Just because you're the loudest doesn't mean that you speak for all of us, and you certainly don't speak for all of Carter County where I live. You certainly don't speak for me, and you certainly don't speak for my family. Please take note that some people continue to drag up past issues that are no longer relevant into the spotlight so they themselves can have something else to talk about and grasp at being relevant and being seen for their own personal agendas. It does not speak for my family. For my family, whenever there's an emergency, and we have been to Sycamore Shoals more times than I can count this year, we never hesitate to know that we're going to have the very best care from our friends at Sycamore Shoals and from JCMC. Every time, every visit, we've been met with kindness, compassion, and excellent care, no matter how many times we've come through the door. Thank you.
Ronnie Sanders, Sanders. I'm here on behalf of my best friend David Stamper, who in 2023, April the 13th, went to the ER in Holston Valley Hospital with chest pains, and they sent him home with a diagnosis of acid reflux. The next day, on the 14th, David came by to drop by my house, and he relayed to me, he said, I thought I was having a heart attack. And I said, well, what happened when you went to the hospital? He said, they said I had acid reflux, sent him home. And the next day, on the 15th, he went back to the emergency room with pains in his shoulder, and they diagnosed him with pneumonia, sent him home. He died that night, April the 15th, 2023. David was a graduate of Dobbins Bennett High School. He was a veteran of the Vietnam War, a good father, a good husband, a good friend. And I'm here today to let you know that I'm speaking on his behalf. And I'm sure there's other war stories there about the emergency room here that I've heard personally. And I think it's good in time that we do something about this, because there's people dying. This is not just politics. This is about people's lives. Let's stand up and do the right thing. Let's get some good health care here in Kingsport, Tennessee, and the Tri-City area. Thank you very much.
Hey there, I'm Debbie Range, R-A-N-G-E. Thank you for listening to our comments and concerns. I live in Kingsport, and my experience is with Holston Valley during the past 4 years. Let me begin by sharing that my 86-year-old family member was taken to the ER with a heart attack, was in the cath lab immediately with 100% blockage, and received excellent care. My concerns stem from knowing 2 people in the ER with active GI bleeding and no GI doctor available. How is this better health care? Also had a friend in the ER with stroke symptoms. They had a CAT scan and told there was no neurologist available, and that they would have a video call with a contract neurologist in Florida who told them that the CT looked okay and he could go home. My friend told the ER doctor something's obviously causing these symptoms, and I'm afraid to take him home. Fortunately, the ER doctor agreed, ordered an MRI, and found the stroke. Also, my husband had a brain bleed approximately 3 years ago, and the ER doctor told us that if he needed surgery, he'd have to go to Knoxville, 100 miles away. How is this better health care? From this monopoly with no specialty providers available. At the same time, we've had ER service providers reduced. Mr. Alan Levine's income doubled from $2 to $4 million yearly. Also, one of the first things this monopoly did was to close the neonatal ICU at Holston Valley, putting the very most vulnerable at risk of delayed care and need for transfer. My husband and I also lost 3 providers after this monopoly was created. They left the area. During the past few years, Mr. Levine has been on the local news multiple times stating the nursing shortage is the cause for many of Ballad's care issues. Let us consider we have a medical school in Johnson City and 9 nursing programs in this area. Ballad's merger monopoly, in fact, cut nursing pay for experienced nurses. No wonder there's a staff issue. If Ballad cared as much about the staff's income as they do their executives, there probably wouldn't be any shortages. Or have to pay out $160 million for contract labor as they did in 2023. In closing, Ballad sold this largest state-sanctioned hospital monopoly in the United States to the public with a huge marketing campaign. Okay, I lost my place, sorry. But the reality is very different. I have several friends that now travel out of this area for health care. Over 1 million people are depending on you to review this self-serving monopoly that won't even allow non-Ballad physicians to take care or provide services. Thank you.
Mrs. Range.
I'm Carolyn McPherson. It's McPherson. And I'm probably one of the few people in this audience that was born at Holston Valley Hospital. I've lived here most all of my life. And I think we can all agree that the primary focus of Ballad Health should be the provision of excellent health care for our region. In my opinion, Ballad has failed our community. Kingsport has long placed a strong emphasis on quality of life. Health care, of course, is one of the tenets of quality of life, and Ballad has failed our community. We are not interested in providing money for legal services, STEM education, StreamWorks, all these other opportunities when we could be using that money to attract physicians and staff for our hospitals. And I don't think that that really is under the purview of Ballad Health. We are interested in excellent health care. You cannot be all things to all people. I think Ballad has lost sight of its mission. As a native to this area, I have watched a steady decline in the Ballad services. And as I said, I was born here. I know my husband had wonderful cardiac care under CVA. There are some exceptions to all that. All these wonderful stories we've heard today, you know, I'm amazed. But you also have to think about all the services we have lost. And we have a two-pronged system now. Those people who can go to Asheville, to Knoxville, to Nashville, Cleveland, Houston, and those who cannot afford to do that. My sister-in-law is on her way to Nashville right now for a surgery appointment that she got 2 weeks ago, and it would have been January before she could have gotten the appointment here. So we can't allow that to continue. We need Ballad to utilize its resources in improving our services, attracting the best doctors and other healthcare staff. We've lost too many great doctors and staff. They've either retired or left the area. Ballad has failed our community. They need to recognize their shortcomings and concentrate on providing strategies to significantly improve the spectrum of and quality of services. They need to go back to the basics of striving for excellence in health care. And I thank you for the opportunity to speak my
Sally Long, Bristol, Tennessee. So I'm a Tennessee resident, and while Ballad Health is a good hospital and they have good employees, I'm going to be frank, this COPA needs to go. My husband has cancer, so what do? We try to go to Johnson City to a doctor who specializes in this type of cancer, and he sits in a waiting room without water for 2 hours with a bunch of sick people. And that's every time he went. Well, he was eventually referred elsewhere, but we ended up Googling for this type of cancer, and Duke was in the top 100. So my husband, Ballad Health wasn't on that list. So my husband gets in his vehicle, drives out of Tennessee, spends his money in a hotel, in Durham, North Carolina, in the ghetto, to go to this specialized doctor. That's what happens because of this COPA. My mother was in the hospital, broke her back, 3 days, maybe an extra 4 days. She didn't have surgery, but the bill was $120,000 at Ballad. My husband had to get an iron transfusion, so he went over here to Ballad. $15,000 each transfusion, twice. He has crappy insurance. He would have gone to Vanderbilt, but Vanderbilt didn't take his crappy insurance. But all I'm saying is we would have access to all of these great hospitals if you would get rid of this COPA. That's from a Tennessee resident. Vanderbilt would have a specialty wing over here. I heard they were actually going to open one, but the COPA prevented them from moving their wing over here. We need competition. I was a procurement director for 30 years. This will give more opportunities to the employees. It will get them specialized in certain areas. Not only will we have a nurses program, but we'll have more nursing programs for this brief flux of people moving to this area. And let me just end it by saying Ballad Health, when everybody had COVID, they took everybody outside in the emergency room. They had them stand beside each other within inches of each other, coughing, so they could check their temperatures to see if they had COVID before they let them in the emergency room. So if you didn't have COVID, then you did. Thank you.
Hello, I'm Juanita Mitchell, Mitchell. I'm a resident of Kingsport. I am very concerned as a citizen that Ballad has fallen short of 3/4 of its quality of care goals that have been set by the state. That is 75%. This can be found in the annual reports from the Tennessee Department of Health and from Ballad itself. They have failed to meet state benchmarks in infections, mortality, ER speed, and patient satisfaction. This is unacceptable. On a personal note, I have a great-granddaughter who is 18 months old now. She was born with multiple physical special needs. It was known that she would have these needs. My granddaughter's a resident of Kingsport. Kingsport no longer has a neonatal unit, so all delivery and everything, she had to drive to Johnson City. This child has had open heart surgery at Vanderbilt. This child has had 2 hip dysplasia surgeries at Vanderbilt. She has kidney issues and has to go to Knoxville. She's 18 months old. This is unacceptable. So I'm asking you to please remedy the situation. Thank you for your time.
Hello, my name's Tom Cole, C-O-L-E, okay? I didn't have a speech writer, so you'll just have to let me ramble on, okay? Let me say up front that the scenarios that I'm giving you, I have nothing but the highest regards for the clinicians and the physicians that treated my wife. She had an accident. She fell from a retaining wall on June the 3rd of this year, broke her back, and was taken to our only trauma center. As a result of a MRI, they found out that she had 5 broken vertebrae and that certainly she would need surgery. The surgeon came out and said, Mr. Cole, I've got her scheduled for Wednesday of next week. She came in on a Tuesday, so it was 8 days she was going to have to wait before she could have surgery. And I said, I'm sorry, what's the deal? He said, I can't get a surgical suite. He said, that's the first surgical suite that's available. And I'm sure most people don't understand this. I didn't I've been following COPA all along. Anyway, I said, well, I'm sorry, that's not acceptable. I want my wife transferred. I need to have her transferred out. We need to go to another hospital where she can get the services she needs. I found out something else that nobody seems to know. Ballad has a reciprocal agreement with any hospital within 200 miles of their facilities. If the service can be provided with Ballad, those hospitals will not accept those patients. He said, now, if I were sending your wife for scoliosis, which is a curvature of the back, for surgery, we don't do that here. So the hospitals there would accept her. But he said, they won't accept her because the service she needs, we can provide. We just can't provide it until next week. Okay. I'm sorry, but we did a lot of praying. Thankfully, after 4 days, a surgical suite became available, but even 4 days, in my opinion, was too much. Let me say that COPA is not working. Competition is what's needed. Let me give an example of several years ago in 1976. Holston Valley Hospital had an HCA hospital come in that thought it was going to be the doom of Holston Valley. It made Holston Valley probably the best hospital in the area because of the competition from HCA. Thank you very much.
My name is Rachel Hicks, Hicks. Okay, so can I take a minute? Is that okay? So here's the thing. I'm autistic and I have ADHD, okay? I'm a very high functioning, or I was very high functioning. I am a professional. I have my master's, I have my bachelor's, I have several degrees, I have several publications. I can pull up my CV. I've heard so many stories, and it breaks my heart because I'm hearing a very common occurrence, the ERs. For someone who is autistic, I went to 2 separate of Ballad Health. I'm trying to see, okay, who's Ballad Health and who's who? My apologies. I went to 2 different Ballad hospitals, 2 different ERs, 2 separate occasions. I filed a complaint. I am a professional, and I know what in the hell I'm talking about, excuse my language, and I'm hoping it's not going to get colorful more. What I endured as an autistic person with so many overwhelming sensations. I hear all of the buzzing, all of these sounds, the echo. I am seeing and noticing every single shift in here. When someone is in crisis mode from extreme trauma, going to one of your ER, not one of your ERs, but I see suits, maybe y'all are Ballad. Going to Ballad Health's ERs will cause you more trauma that you have to actually try to heal from. I experienced this as I was in, I'm about to get vulnerable. I am one of the beaten down single mothers from trauma and not knowing better and just trying to live life. I am in that impossible situation where I am essentially homeless. I have a 15-year-old with special needs that has narcolepsy with cataplexy, and I have to take her to Vanderbilt for care. My other kid has Chiari malformation. Being neurodivergent in this region, in this area of Appalachia, sucks because we are forced to go to Ballad. That is our options. And I have met some incredible, amazing physicians that I would love to powwow and brainstorm and just pick their brains with on different treatment ideas, because I have submitted proposals to Ballad. I have submitted proposals to Marsha Senate and everything else, okay? There are ways that Ballad and this culture, this country, can be able to invest in a different type of treatment. I'm a neurodivergent clinician. I can give you a whole different perspective, and I work with Southwest Regional Jail being a psych associate and working in that type of mental health care for a really long time. I know I'm over. But there needs to be a change. There needs to be a different form of treatment that is not so overwhelming and overstimulating that it puts people more into a shutdown. I am going mute. I am unable to function because I am in an autistic shutdown, and the complaint that I filed against Ballad was unheard. It was invalidated. They basically told me I didn't know what I was talking about. Is that a response? No, that is complete and utter diversion because they don't want to face the fact that they are part of this existential crisis that we are in. We are in this trauma cycle, this trauma bond with medical. I am tired of physicians trying to throw mood stabilizers at me. I don't have a mood disorder. I'm autistic. And I'm really, really tired of not being heard. Thank you. Sorry for going over.
Ms. Hicks, thank you for your comments.
Hi, my name is Ginger Carter. I'm a local physician in the area, and I've been practicing medicine here since 2008. First of all, thank you for coming. This is overdue. I feel like I actually spoke here 2 years ago. My testimony is recorded. I actually did not plan on speaking, but I felt like I could not listen to everything and not say something. First of all, I want a robust hospital system, for sure. We have excellent providers in the area, but they're quickly leaving for many reasons. And why is that? And I would invite any of you to come follow me a day in my office. It is sad to me that this is not what I want to hear, but if you go into my office and you ask the scheduler, what's the most common phrase you hear? Very unfortunately, you can schedule that anywhere except Ballad. That's the most common phrase, and I'm sad about that. Why could that be? The physician that spoke earlier is right. The cost of Ballad is several times that of places like HMG. In addition, if I send a patient to Ballad, I've had radiology scans that have not been read for weeks. The patient will come, the scan's not read. Thankfully, I have friends in radiology, physicians. I call them, hey, do you know why the scan's not read? Well, a lot of them have left Ballad now, and they explained to me that it's being outsourced to places like Australia. And so the scans are weeks behind. I don't know if that's the case right now, but that is how I'm having to do workarounds every day in my office. In addition, I have a patient that works and lives in a very rural community. She travels an hour to see me. She really needs follow-up. We called her, hey, Dr. Carter wants you to come in. She said, I can't afford to come in. I can't afford my copay. Why is that? Because Ballad has sued her and garnished her wages for an unpaid bill, and she only makes minimum wage. To care for her, I've offered just to see her for free because she needs care. When I questioned her about it and asked her to bring her bills, it appears that the unpaid portion of her bill is actually higher than if she were a self-pay patient. Her wages are being garnished for this. She does not make much money, and there are many other stories just like hers. Ballad's even sued their own employees at times without the employees even knowing that they had an unpaid bill. And that could be a clerical thing, but it is true. If you have ever read, and I would highly recommend and encourage you all to do this if you're going to do this job, and thank you for doing it, The Price We Pay by Dr. Marty McCary, who is currently serving as the U.S. Commissioner of Food and Drugs. He basically describes what's happening right here in the Ballad Health System. I already told you I went to med school here, and then after getting married, I came back in 2008. When I came back, I loved it. I thought I was in the best medical community. I was so excited to be here. I am telling you, it is not the same. This is not the same anymore. It makes me sad. As I said, I spoke in this hearing. I did not sign up to speak tonight, but I could not sit and listen to this without this, because I love my patients, I love my community. But just as the other physician said, I got threats from the CEO of Ballad Health within probably 24 hours of speaking. He threatened me. He threatened a lot of things, and I still have all that recorded. You can pull that testimony. All I talked about was patient care. I have nothing to gain personally by being here tonight except threats and retributions for my job and my credentials and privileges. But I love my patients. I love this community. I'm going to stand for truth, and I'm going to stand for what is right. And as a physician, if I'm too scared to do that, I've got to do something. I can't do that and be a physician here. Thank you for your time, but ladies and gentlemen, that is where we are, and we need your help.
Thank you for your comments, Dr. Carter. Okay, so that's the end of the speakers that have signed up. Thank you all for your comments, your patience, and your consideration for each other. You may continue to submit any further written comments to us through the Tennessee Department of Health website until the close of, let's say, Friday, December 5th. Next week is Thanksgiving, so it's sort of an awkward week, in order to be included in the consideration of this record. Otherwise, thank you very much and have a lovely evening.